Hello here, welcome to my channel Pharma Digital Anup. Today we are going to discuss about the some important MCQ of drug acting on cardiovascular system. So first question is the normal pacemaker of the heart is A AV node, B SA node, C bundle of His and D Purkinje fiber. So here the right answer is option A AV node. So in this picture you see that this green part is SA node from where the electrophysiological current of the heart is generated. Then it travel through the atrioventricular node and then it pass to bundle of His and then it pass to the Purkinje fiber and it makes the heart to beat. Here in this picture we see how this SA node generate the signal and this electrophysiological signal transfer up to the Purkinje fiber and it makes the heart to beat. Next one is digoxin is primarily increase option A sodium excretion, option B myocardial contractility, option C heart rate and option D renal blood flow. So here the right answer is option B myocardial contractility because this digoxin is coming under the drug that are useful in the treatment of congestive heart failure, and the congestive heart failure is a type of disease where the heart unable to contract properly and unable to pump out. So here this drug has beneficial effect on myocardial contractility. Next question number 3, which drug is a loop diuretics commonly used in the congestive heart failure? Here the 4 options are already visible on the screen. So the right option is furosemide. Question number 4, the preferred drug for rapid reduction of severe blood pressure in hypertensive emergency. As you know, 120 by 80 mmHg is the normal blood pressures, and the blood pressure when it cross the 200 by 140, then it considered a severe emergency case, and in that case we need some drug. Option A sodium nitroprusside, option B etinolol, and option C hydrochlorothiazide, and option D methyl dopa. So here the sodium nitroprusside falls under the vasodilator group of antihypertensive drug. Due to severe vasoconstriction, the blood unable to flow properly and it makes the severe blood pressures, and the drug like sodium nitroprusside. Another one drug also have that is known as minoxidil, but it has some sexual dysfunction related disorder like erectile dysfunction or impotence, that means lack of sexual desirness. Due to this side effect, the minoxidil is less popular as a vasodilator. So here the option A sodium nitroprusside is the right answer. Next, question number 5, which drug is an AC inhibitor? As you know, in AC inhibitor the suffix pril r comes with the drug name. Option A losartan, option B enalapril, option C amlodipine, and option D propranolol. As I already discussed, the drug that comes with the pril suffix that considered as AC inhibitor. Here the option B is the right answer. ACE means it is enzyme angiotensin converting enzyme, and this enzyme secreted from the lungs, you have to remember. Okay, next it comes to question number 6, amlodipine belongs to which group? AC inhibitor, calcium channel blocker, beta blocker, and alpha 1 blocker. So here the right option is option B calcium channel blocker. So in this picture you see that amlodipine, this is the amlodipine, and it coming or falls under the calcium channel blocker of. Okay, so the question number 7, the drug commonly used for immediate relief of an acute attack of angina. First one is nitroglycerin, second one is atorvastatin, third one is digoxin, and fourth one is amiodarone. So here the right answer is option A nitroglycerin. Next we comes to question number 8. Amiodarone is classified as option 1 class 1 antiarrhythmic drug, option 2 class 2 antiarrhythmic drug, option C class 3 antiarrhythmic drug, and Option V, class 4th arrhythmic drug. So here in this picture we see that amiodarone belongs to class 3. Amiodarone belongs to class 3 inhibitor. So here the right option is option C is the right answer. Next, the enzyme inhibited by statin, COX-2, HMG-CoA reductase, AC inhibitor and PDE5. So here the right answer is HMG-CoA reductase enzyme in which statins is inhibited. The statin enzyme inhibited this HMG-CoA reductase and act as the anti-hyperlipidemics. Next, which lipoprotein is commonly referred to as bad cholesterol? As you know, there are two types of cholesterol present in our body. One is bad cholesterol and another one is good cholesterol. So here the option A, HDL, high density lipoprotein, B, LDL, low density lipoprotein, C is a plasma protein albumin, and D is a chylomicron. So here the right answer is bad cholesterol, option A, high density lipoproteins. Here the right answer is option B, low density lipoprotein is considered as bad cholesterol and high density lipoprotein is considered as good cholesterol. Okay, next we comes to question number 11. Spironolactone acts primarily by blocking beta 1 receptor, aldosterone receptor, AT1 receptor and calcium channel. These are all comes in the category of antihypertensive drug. So here the question is spironolactone. So spironolactone comes under the categories of aldosterone antagonist. So here the right option is aldosterone antagonist. Option B is the right answer. Next, question number 13. This is the you already covered 12 now questions. The plateau phase of the ventricular actions potential is mainly associated with the calcium influx, sodium influx, chloride influx and magnesium influx. So here the right answer is calcium influx. Option E is the right answer. Which antihypertensive drug is centrally alpha 2 agonist? Here the right answer is clonidine is act as a alpha 2 agonist. Here in this picture we see that how this clonidines act on alpha 2 agonist and reduce the hypertension. Methyl dopa is particularly associated with the treatment of hypertension. Option A, childhood. Option B, pregnancy. Option C, hypothyroidism, and option D, myocardial infarction. So here the right answer is option B. In pregnancy case, the methyl dopage is very much essential for the treatment of hypertension. Which drug is contraindicated with nitrates because of severe hypertension risks? From the above four options, the right answer is sildenafil. Sildenafil comes under the categories of PDE5 inhibitor, and that is act as a vasoconstrictor and it is useful in the treatment of erectile dysfunction. Next, lidocaine belongs to which class of antiarrhythmic drug? Here the four options are already visible. So option A is class 1A, class 1B is the options B, class C, class 2 and option D class 4. So lidocaine is the class 1B weak group. From the above picture we see that the lidocaine 1B group. So here the right answer is options B. Next we comes to quinidine belongs to which group? Class 1A, class 1B, class 1C and class 3rd. So here the right answer is class 1A, that is the sodium channel blocker and comes under the strong category. That's why it is falling under the class 1A group. Flecainide belongs to class 1C. This is the weak category of sodium channel blocker, that is comes to the class 1C group. Okay, next comes to the option 20. Question number 20. Which antiarrhythmic drug block the potassium channel predominantly? Amiodarone, lidocaine, verapamil, and propranolol. So here the right option is option D. Option A. Amiodarone is the potassium channel blocker. Next, question number 21. A common adverse effect associated with the amiodarone: pulmonary toxicity, severe hypoglycemia, peptic ulcer, and ototoxicity. So here the right answer is pulmonary toxicity. Question number 22. Which drug inhibit intestinal cholesterol absorptions? It is this question is coming from the antihyperlipidemic drug. First one is ezetimibe. Second one is atorvastatin. C is fenofibrate, and D is niacin. Here's the right answer is ezetimibe comes under the category of intestinal cholesterol absorptions. From here, in this classification, sterol absorption inhibitor, we see that ezetimibe, it comes under the category of intestinal cholesterol absorption. Next, question number 23. Nicorandil has nitrate link and potassium channel opening. First, I want to mention here the nicorandil is a very much effective drug used in the treatment of angina pectoris. So here options B, AC inhibitor, option C, statin activity, option D, beta blocking activity. So here the right option C is similar to nitrates, and it opens the potassium channel and act as anti-anginal. Okay, next comes to the next questions. 24. Cholestyramine is a bile acid sequestrant. Statins, fibrate, and PCSK9 inhibitors. It is a drug category that is falling under the antihyperlipidemic drug. So here the right answer is bile acid sequestrant. This is from this slide we know that cholestyramine and cholesterol, these are the two drugs that come falling under the subcategory of bile acid sequestrant, and that is also known as resins. And this is the last question of this video. The major target of the fibrate is PPAR alpha, HMG-CoA reductase, ACE, and sodium potassium ATPase. So here PPAR alpha is the right answer. This fibrate drug target PPAR alpha enzymes, and the full form of enzymes is peroxisome proliferator activated receptor. This interact on this receptor and inhibit the triglyceride lipolysis occurs and decrease the free fatty uptake by the livers and act as a antihyperlipidemic. So this is all about the today's video, and here we discuss 25 more important MCQ in point of view of your competitive examinations as well as semester. Hope you enjoyed the video, and please don't forget to like, share, and subscribe. Thank you.